Never feel like you and your family are ever alone. United Cerebral Palsy is here to help, connecting you with resources, understanding, and compassion. UCP of Sacramento and Northern California, life without limits for people with disabilities.
My name is Dennis Hart. I'm a pediatric rehabilitation medicine physician from Sutter Health, and United Cerebral Palsy is a program that provides significant social services to kids with chronic health care needs. Well, UCP is important for families because it provides many of the needed social services that help the family and the patient live a more independent life. It provides respite services for family members to give them a break, but it also provides services for the members themselves to allow them to become more independent in the community. When a child comes to me with the parents concerned about their developmental issues, the first thing is really diagnosis, finding out the cause for their delays, and reassuring the parents what services are available to allow them to help try and achieve the best life for their child that they can. So I spend a lot of time talking to the families about what services are available, both from a medical standpoint and a social standpoint. We often talk a lot about education. We talk about regional center services and what are available to them. But it's really explaining to the families what the process is of making sure their child is getting adequate services. The process varies based on the diagnosis. There are oftentimes times where they need multiple healthcare providers, neurologists, gastroenterologists, sometimes surgeons, orthopedic surgeons, and I see my role as the person who kind of directs that care for kids with chronic health care needs, that make sure that they are getting the appropriate referrals. That would include things like physical, occupational, and speech therapy. And my role is to explain how each of those processes work, and to make sure that the family understands what their role is in getting those services. Oftentimes when a parent comes into my office, they want to know what to expect for their child in the future. And oftentimes I will discuss with them different services that are available. We'll also discuss issues like life expectancy and how much of a disability will they have, whether the child's going to be able to walk, whether they're going to be able to sit. And much of our first conversations are about how do you handle that as a parent. So the most important thing that families can come away from their medical appointments are, one, understanding what the medical diagnosis is and what it means for their child, both in the short term and the long term. Second is understanding what services are available for their child. And third is learning how to advocate for those services.